Most of healthcare is still very focused on after you become ill. We want to change the dialogue and develop the science around ideally prevention of the illness. So then when we can't prevent, at least early detection, so that we can intervene early for better outcomes. The Precision Health and Integrated Diagnostics Center, the PHIND Center, is a relatively new effort to try to really tackle being much more proactive about healthcare. The precision health part is, again, the focus on keeping people healthy as opposed to reacting after they're already ill. And the integrated diagnostics part is about integrating multiple sources of information. We want to fund novel new ideas, bring together scientists from multiple disciplines all over campus in healthcare, in engineering, chemistry, physics, psychology, computational sciences, to approach a precision health problem.
We're interested in developing approaches to ultimately detect cancer at the earliest possible stages. So we're measuring molecular features that are present in the blood that can give us a readout on the state of healthy or diseased cells. If we can catch the hallmarks, the signatures of early malignancy at a stage where we can readily treat it, we stand a far better chance of curing patients. And we want to roll the clock back on when we can pick this up.
We have a cohort of about 200 boys and girls that we've started studying when they were 8 to 10 years old. So it's a large data set that we're going to be able to then integrate to predict the onset of depression, the onset of suicidal ideation, suicide attempts in some of these children. If we can identify what that risk profile looks like, then we can try to develop prevention programs that target those mechanisms that we're identifying that we think are going to contribute to the development of depression and suicidal ideation, to change those mechanisms.
Diabetes is a huge problem. It's estimated to cost the U.S. close to $300 billion each year. And what's amazing is that 9 out of 10 people who have prediabetes have no idea. So a big part of our PHIND project is actually to try and understand exactly what foods spike their glucose and then come up with some machine learning methods. What that means is some computer technologies to be able to understand for that person what's causing them to spike, what's not, and then actually making recommendations. We're going to help each person individually according to what is good for them and to have them avoid what's actually bad for them.
Our hope is that by the time you're born, we know what diseases you're going to be at risk for. This does not mean that there still won't be need for hospitals, but the goal will be to keep people healthy as long as possible by doing more continuous monitoring and earlier interventions.
If the 19th century was about chemistry and the 20th century was about physics, the 21st century is for sure about biomedicine. We're seeing people from fields that previously hadn't been that concerned about biology and medicine looking at and being focused on biomedical problems. The problems that we confront and want to have impact in with precision health are so complex that to really tackle them effectively, we have to bring together people from different disciplines with complementary talents in ways that break down these problems and achieve the solutions that we want to see.